The Crime and Justice Institute at Community Resources for Justice is pleased to welcome you to the Systemic Intervention webinar series. During the first two webinars, we discussed data analysis and selecting a systemic intervention, and this webinar is the final in the series, titled Implementation of Systemic Interventions. Gabriella Priest, and I'm a research assistant at the Crime and Justice Institute, CJI, at Community Resources for Justice, CRJ. In support of CRJ's mission, CJI provides nonpartisan consulting, policy analysis, and research services to improve public safety in communities throughout the country. We work with a diverse group of practitioners and policymakers, including corrections officials, courts, law enforcement, political and community leaders, and local and state jurisdictions across the country. Our primary goal is to make criminal and juvenile justice systems more efficient and cost-effective in order to promote accountability for achieving better outcomes. These webinars were developed as part of the technical assistance that CJI is providing throughout the state of California in conjunction with the Chief Probation Officers of California, CPOC, the Public Welfare Foundation, and the National Institute of Corrections. Our webinars have been thoughtfully designed to reach diverse audiences and stakeholder groups by incorporating various perspectives, all aligned by the principles of systemic interventions for improving local criminal justice systems. The these webinars was created by the Systemic Intervention Work Group of CPOC to build a community of learning and a network of practice among various criminal justice system stakeholders working together to improve local communities. This webinar is the final webinar in a three-part series that took place over the past 3 months. The PowerPoint with audio, complete panelist bios, and other resources will be available for download on our website free of charge. Today we'll cover the following areas: brief bios and background of the presenters, an overview of systemic interventions, followed by a feature presentation, an interactive question and answer session where the panelists will respond to your questions. There will also be a brief evaluation at the end of the webinar. Please note, on the right side of your screen, you have the ability to chat with us, to answer poll questions, and to submit questions to the panelists. Please note that this webinar is being recorded and will be on our website within the next week. The webinar started with a poll for the audience. Let's sit and ask what stakeholder group you represent. You should be able to see the poll on the right side of your screen. And to choose the answer to which stakeholder group you represent. This information is helpful in guiding the panelists in what information they are presenting to you. Okay, 15 more seconds to answer the poll. I'm going to share the results with all of you. So it looks like the majority of you are from probation. And we have a significant portion from corrections as well as some who chose the other option. Remind you that anytime throughout this webinar you can submit questions on our panel directly via the question and answer function on the right of your screen. And we'll try to answer as many questions as the time allows during the question and answer period at the end of the webinar. And we certainly encourage each participant or each group watching the webinar to ask at least one question. We have the webinar, and we look forward to hearing your comments and feedback on the brief evaluation following the completion of the webinar. We use feedback from all of our webinars and events to make modifications and to be more responsive to audience requests, so we encourage you to take that moment to offer your feedback. To introduce today's moderator and feature presentation, I'd like to take time to recognize and to thank the members of the Systemic Interventions Work Group. For most of the past year, CJI Associate Christy Danford has had the pleasure of getting to know two gentlemen as they work together to develop the Systemic Intervention resources. Thank you, Chief Mac Jenkins from San Diego and to Chief Scott McDonald from Santa Cruz for your insight, expertise, leadership, and support throughout this process. I'd also like to thank Christy Danford from CJI for her substantial contributions to the work group and for helping to get webinars together and to make them possible, as well as Kristen Nielsen from CJI for her technical assistance and support. Really appreciate the assistance we received well from Stephanie Anderson, Fock, and all of the chiefs in California for spreading the word about this series. Thank you all. And I'd like to introduce our moderator and our overview presenter, Laurie Evo. Laurie is a correctional program specialist at the National Institute of Corrections in Washington, D.C. In this position, she works in the Community Services Division, which supports county, state, and federal pretrial, probation, and parole agencies throughout the United States, providing training and technical assistance. She is currently the initiative manager of the Framework for Evidence-Based Decision-Making in Local Criminal Justice Systems. Prior to joining NIC in 2009, she worked for Multnomah County Department of Community Justice, where she was the program manager of pretrial services and adult parole and probation supervision units. Laurie also worked with Oregon Youth Authority as a program director of the Rogue Valley Youth Correctional Facility, where she was responsible for treatment services and conditions of confinement for incarcerated youth. She has worked as a certified and licensed occupational therapist and acute physical rehabilitation, as well as the Oregon State Hospital's forensic unit. Welcome, Laurie, and thank you so much for being moderator today.
Hello, everybody, and thank you for having me. I look forward to spending the afternoon with California so we can share the perspectives sort of at the national level and also the local levels from the panelists that are here. So thank you for being here, and thanks for inviting me.
Great, Barry. Next, we have Chief Brian Coco, Chief Probation Officer with the Connecticut Court Support Services Division, CSSD. Chief Coco received his MPA from the University of Hartford in Connecticut and has 24 years of experience with the State of Connecticut Judicial Branch. He has worked as a probation officer, a lead probation officer for training, a quality assurance coach, and is currently Chief Probation Officer. Coco assisted with projects related to CSSD's risk reduction program and in the development of CSSD's automated tools. He also has experience with writing policy and evaluating research data. In addition to his work in Connecticut, Chief Coco is also currently a consultant and trainer for the Department of Justice. Welcome, Chief Coco, and thanks for your participation in this webinar.
Thanks for having me. I'm looking forward to helping out and hopefully answering some questions. And I hope to be able to bring a local perspective to some of the things we've done here that hopefully will help California as they move forward.
Great, Chief Coco. We're really excited to have a great team of experts from Connecticut here with us today. Our second panelist is Tom Hogan, Best Practices Coach with Community Partners in Action. Tom Hogan received his bachelor's degree in Social Systems and Policy with a criminal justice concentration from the University of Hartford in Connecticut. Tom began working as a Connecticut probation officer in 1988 and served as a chief probation officer from 1998 to 2001. When Connecticut first began to implement evidence-based practices in probation in 2001, Tom worked as a best practice quality assurance coach and alongside several other probation staff was assigned to train Connecticut officers in risk assessment and motivational interviewing. Tom assisted with development of automated versions of the assessment tools, the development of an automated case plan system, ongoing staff training, and the implementation of the Woman Offender Case Management Model. Currently, Tom is a quality assurance coach with Community Partners in Action, a nonprofit agency based in Hartford, Connecticut that provides rehabilitative services to criminal justice clients. Welcome, and thanks for being a panelist.
Welcome, and I look forward to helping with the presentation. I'll be representing the perspective of the service providers that provide treatment for the criminal justice clients here in Connecticut.
Great, happy to have that perspective today's webinar. Our panelist is Maureen DeLude, Program Manager at Connecticut Court Support Services Division. Maureen received her MPA from University of Connecticut and has been employed by the Connecticut Judicial Branch for 22 years, the 4 most recent years for Connecticut's Court Support Services Division, CSSD. CSSD is responsible for pretrial services, adult and juvenile probation, child detention, and family services, along with a wide network of contracted service providers that deliver services such as mental health and substance abuse treatment and cognitive behavioral groups that address criminal thinking and antisocial behaviors. As the program manager of CSSD's contractor data collection system, Maureen leads a talented team tasked with designing, implementing, and quality assuring a web-based database for treatment service providers and creating opportunities to use that data through reports and research. In 2005, the division's contractor data collection system, CCS, was developed to enhance the division's ability to use empirical evidence to support driven decision-making. CCS is an innovative data system that collects client-level treatment process and outcome data. Welcome and thanks for participating today.
Thanks. In honor of all our friends out in California, we had a snowstorm last night here in Connecticut, so thanks for letting us be a part of your day.
Also had snow in Boston. I'm sure they didn't in California, so we're glad that everyone could be on the call today. We need everyone's time, and we are sure that the experience and site will be really beneficial to the people in California attending this webinar. At this time, I'd like to hand over the webinar to the moderator, Laurie Evil. Thank you, Laurie.
Gabriella. I'd first like to help set up the context for our discussion today and ask the audience a question. I'd like you to please respond to the statement. Analysis is crucial to evaluating effectiveness of systemic intervention. Do you strongly agree? Do you agree? Are you neutral on that statement? Do you disagree, or do you strongly disagree? You complete the poll. I want to remind you again that any time during the webinar you can submit questions to our panelists through the question box on your screen. You need 15 more seconds to answer. We have a pretty strong agreement within the audience, so that is actually good. And so we're glad that you strongly agree with the premise that data analysis is critical to the effectiveness of the systemic interventions and the outcome. So I appreciate you taking that poll. Okay, so we will move into the content of the webinar. I want to review with you the goals of systemic intervention, which these should look familiar to you if you have been a part of the previous webinars. The overarching goals are the data-driven solutions, that we use data-driven solutions for justice improvement, identifying and implementing more effective ways to reduce crime and recidivism, hold offenders accountable, and reduce reliance on incarceration through safe and effective interventions at various process and decision points. And that we complement and build upon offender-focused interventions by providing a system lens or frame. These should look familiar, and these are the guiding principles that were set up for systemic interventions. And quickly, these top 5 were reviewed and went into more depth in the first 2 webinars, and they are looking at leadership, collaboration, and self-critique as essential, that we believe in a systems perspective, commitment to thoughtful planning and data-driven decisions, that we examine key decision points, and that we build capacity through a continuum of options to safely reduce reliance on incarceration. So this highlighted, these 3 are the guiding principles in which today's webinar will focus on, and that's innovation and replication. Looking at your practices from the policy level to practical implementation and your commitment to research-based practices. So those are our goals and our values of systemic intervention. And here, this also should look familiar to you, as this is sort of the circle around systemic intervention practices. And the first webinar, Travis County, went in depth, looking, sharing with you the processes that they went through, looking at data-driven assessments. In the second webinar, Charlottesville, Virginia shared with you the process that their criminal justice system went through in planning and actually looking at their data or the data that they had, working with their criminal justice teams, and targeting those areas for systemic intervention. Today, the folks from Connecticut are going to share with you sort of the bottom two pieces of pie, and that is when you select an intervention, how the process and planning in which you go to for implementation, and then the process of evaluation to see if your implementation strategies work. So some key notes to look at when you're wanting to connect data to your implementation process. I think that this is a value. Data is a guide to the process of stakeholder engagement and involvement. And if you know your data well, and if everybody is confident about where the data comes from and its accuracy, this can actually be a very neutral place for all your system stakeholders to begin to make analysis and implementation decisions. It also allows you to focus your planning process on specific needs. One very concrete example of this is when you take off-the-shelf interventions such as risk assessments. You want to be sure that you validate those or adapt them to your local population and needs, but being sure that when you make any adaptations that you are not compromising the validity or the fidelity of the intervention. And lastly, data helps to assist with measuring your desired outcome after evaluation. We're moving away from anecdotal reviews of outcomes, and we really are beginning to look at how our data can measure the effect of the intervention. One of the initiatives that the Institute of Corrections has been investing in since 2009 is the evidence-based decision-making in local criminal justice systems. And this really is a systemic approach to reducing recidivism and increasing the safety of communities. It's very much in line with the work that you're doing in California. And the overarching goals of this initiative is one, I think this is very important when you begin to look at examining your system, is that you affirm existing practices that have demonstrated effectiveness. Also want to foster an environment that inspires and challenges practices that can be improved. One of the things that we have done, and I want to share this as a resource to you, is we have created a series of tools and processes for your planning and implementation as a part of the evidence-based decision-making framework. And we have here the link that you can go to that site, look at what 7 other jurisdictions processes that they're going through to do very similar work that California is embarking on. And there may be some tools there that can assist you. And lastly, I think that we need to be aware that we embark in an analysis of our system. We begin to look at objective ways of evaluating our effectiveness. This bring up some issues. all partners may not believe that data is the most effective way to measure. And we have to be able, and we must have done the homework to prepare a criminal justice planning groups to be able to sit and address those issues, because they will become barriers to advancement, and they really will block your overall goals. That, I want to also share with you is, how do you know when you have fostered a system that's a value on data and shaping their questions and interventions around data? And this really does happen in the sites that I've been working intensely with, is that when a decision, a policy change, an implementation strategy is proposed to be implemented, one of the first questions that you ask, or that the partner should be asking of each other, is, on what evidence is this decision based? That evidence is either empirical evidence from a broad knowledge base, or it can be your own local evidence, or a combination of both. But you need to be routinely asking yourself and those that you work with, what evidence is this decision based on? You need to, or system, if you are fully functioning in this evidence-based environment, evaluations will be routinely put into place when new policies and practices are implemented, so that you know, or you have a strategy for knowing if those policies and practices are getting you the outcomes in which you're seeking. Another very important piece, and this is very hard for organizations, is that you have to be willing to let go or modify policies and practices when outcomes are poor, or they are not getting you the outcome that you thought that they would. So this is equally important, to be able to let go of some of those policies and practices. And recognize that within data analysis is that you're looking for performance measures over time. So you're looking at trends and improvements over time. So at this point, what I would like to do is turn the discussion to the panel. They can give you an insight into what they did in Connecticut in terms of systemic interventions at the local level. So I'm going to pass the ball over to Coco, Maureen, and Tom, so that they can share with you what they have done in in Connecticut.
Lori, this is Brian Coco. I'm going to be starting off in a little overview of probation and CSSD. Just into the right slide. I apologize for this. So we have Court Support Service Division, and you can see there's about 1,600 employees with a substantial budget, especially for, I think, a smaller state, $200 million budget for both personnel and contracted providers. We have contracts associated with each one of our adult and juvenile probation officers out in the state, where we can directly refer people for mental health, for substance abuse, for care programming, even for some basic needs that are out there. So we're fortunate to have that. CSSD, we have adult probation. We also have the bail commissioner's office, works out of the court. We have the juvenile probation department. juvenile detention, we have the relations department, and a lot of times we share clients there. Contracted services I talked about briefly attached locally to each one of our offices. Then we have our administration. In addition, we have just over 51,000 people on probation any time in Connecticut. 20% of those come on split sentences, doing jail time that's split by probation, or they come straight to the court to the probation department. The term is about 2.5 years on probation. Not down recently because we've instituted a plan to bring cases back to court early when someone's doing well on probation, so we're able to bring the term down and use that as an incentive and let people get on with their lives when they're meeting what they need to be doing. We have multiple specialized caseloads. We have officers assigned to cases where people are coming directly from DOC, the Department of Corrections, to probation. We meet those clients anywhere from 90 to 120 days out prior to the release from correction. We do assessments on them and transition them to an officer in the community who picks up the supervision. And a lot of that was based on research because we found we were losing a lot of clients from the release with the Department of Correction to the beginning of the probation. So we needed we saw that and we had to come up with a plan. How do we get these people to probation? If we lose them at the beginning, it's very hard to re-engage them or to find them, and unfortunately that could turn into a warrant for absconding, and we end up filling up the prisons. We have domestic violence caseloads, sex offender caseloads. Tom's going to talk about the woman offender caseload. We have a gun offender program in New Haven, Connecticut, and we have a technical violation unit. It came about around the same time as the probation transition program. And found there were a lot of people incarcerated in Connecticut on violations of probation and parole. So what we tried to do is, as people started to perform poorly on their probation, we would hand the case off to a specially trained officer who would have access to immediate resources to keep the person in the community, see if we can improve their situation and in their standing with probation so they did not return to court. So a lot of the programs we have, in fact all of them, are based on research that we have, having some solution and implementation there. A little bit about early terms. About 440 line probation officers throughout the state, 85 chief probation officers, and we have about 15,000 clients that are considered low risk based on our risk assessment, and we use the level of service inventory along with the ACES-R to determine someone's risk and needs, and trying to score lower are supervised administratively, do not have to report to the office. We're today about the mental health probation, vendor caseload, our contracted data services, and RBA, as well as our quarterly report meetings and our office metric meetings, and each one of us will probably make different pieces of that. Start off with the mental health probation. Mental health probation in Connecticut started probably about 5 years ago, and based on the data that we had, we thought that we had a lot of clients incarcerated on violations of probation who had psychiatric illnesses, either identified by us or by our Department of Corrections. So people would get on probation and failing because we were not prepared, or as prepared as we should be, to work with them and provide the services. We also found out that there were a lot of low-risk clients based on their bond, which made a little bit of a stretch, but I think was a good starting point. Going on low bonds, but also had mental health scores in our Department of Correction. Again, we thought those people could be supervised in the community instead of being incarcerated and not receiving the mental health services they needed. The first with us, as we had this information, was to share it. We worked with the State Department of Mental Health in Connecticut, which is called DEMIS. Work closely with the Department of Corrections, our judiciary, actually our state legislatures on this, our contractors and the National Alliance of Mental Illness. We reached out to them because we needed a lot of help there, and they were able to provide us with training. We're lucky through them. All officers were trained in crisis intervention training on top of a 40-hour in-service mental health awareness training. Once we had to set a clear objective, which led to in these slides, and with outcomes. We needed to show what we were doing, so we had to have this evaluated to make sure we were accomplishing our goals to keep clients with mental illness in the community, and to lessen the burden on our systems, our prisons, and more importantly, to make sure these clients were receiving the services they need in the community. And we used national research, and luckily there was a fair amount out there, but we got to use our own data. And on some of the things I talked about, as far as the data, also apparent to us looking at our data and national data, that clients with mental illness are failing at a rate of 2 to 1 compared to other clients. So were they getting a fair shot on probation? Were they just going to probation and eventually many of them going to become incarcerated? It's more costly to the state of Connecticut to keep these people in the community. About the second bullet, that was really identifying some of the people in DOC that could be supervised by probation as opposed to be incarcerated. These are the people we did collaborate with. We definitely needed data from the Department of Corrections. We had to build, and we did a strong relationship with them. We talked to others, especially the National Alliance of Mental Illness, because we didn't really have an in-house expert at that time, and they were a huge resource for us, able to turn us on to national data, on the data that we were pulling for ourselves. To provide specialized training to these officers, more important, the second bullet there, I think, on top of that, because what they learned after the training. For clinical support, which we did with the help of the Department of Corrections, who gave us that specialty. It's tough when people are set out to do a new initiative. There was a lot of support from the small group, but a lot of people who didn't know why we were doing this, what the value was. So these people had to be reinforced. They had to understand what success was. Times in probation, we see a lot of failure. We had to be able to recognize success, partly from our day-to-day work, but also in the outcome evaluation that was being done. It was an important focus of where we were going with this, and the goals here was to keep the client in the community, provide them to resources so that they're successful in the community. So we had a fairly clear and an easy measurement of how many clients were returning to jail or getting rearrested. And in the support meetings, we talked about cases, offered them booster trainings. As I said earlier, I think they need to be affirmed for the work that they were doing. They all had close contact with the evaluators because they were doing things for them, so the evaluators would also know what the state of mind was, what their views were in this process. People to services. Our data showed us these people are failing, and then as we into our case plan, our automated case plan on some of our older groups, which ended up being our historical comparison, found our clients were not receiving a lot of mental health services. So it was important to make sure these clients were connected quickly, they received the services and medication they needed. Any client in the community goes back even to the training, because, I have some bullets here. Did we know that these people would have problems on probation? We absolutely did. We knew they were going to have problems reporting to probation. We were diagnosed that people were going to come in who were using alcohol or marijuana. We knew they would get excited in probation, maybe lose their temper, tell the officer that they might hurt themselves. We knew they were going to be homeless, which for a probation officer causes a lot of problems, and finding the client if he's not reporting. We knew we were going to get picked up by the police on nuisance crimes, being in the parks, sleeping in the parks. And it was important that the training address these issues because it's very easy for anyone, probation officer or anyone, to react to these situations. When you have a client in your office, they start to escalate or start to model your behavior if you're getting upset with them. That leads down the road to failure. So these officers had to have a new way of doing business. So we had data, we offered something in the program or this initiative. At the same time, if they were going to do probation business as usual in Connecticut, then the program was going to fail. So they had to have ongoing support, reinforcement, and coaching throughout this process. Contract with Central Connecticut State University. They did an ongoing evaluation of this program, and their further findings first told us, based on the data, that we worked in the right clients for this caseload. We did our assessments accurately in identifying clients who had mental health disturbances or mental illness. Showed great success in this program, and had no clients with mental illness in the program, then we wouldn't be accomplishing our goals. So the first thing was, were we to the right clients? We had significantly better outcomes in the historical group. Our recidivism was just over 20% better than the historical group. I think we had a clarity of focus. We had data to help us start the program. And again, clarity of focus was the goal, to keep these people in the community, keep them there, treatment providers, keep them in their programs, and make sure the officers were doing something additional, something they had not done before. We reduced the number of clients returning to DLC, again, significantly, goes back to that, over 20%. A couple other things we found out through the data and some of the surveys. The office, they needed more access to programs, and they needed it in a really quick fashion, and that was not happening in the first year. Our data, we could see in our case plans that clients were not getting into services because we have contract providers, not always slots available. So, for nobody, clients were not getting the services they needed as quickly as they needed them in all the cases. A lot of that also was housing. So that gave us another starting point to say, if we're going to continue this, we have to increase the availability of programs and beds for clients. We also found, and this came from mostly from staff that did this, it was 10 officers in Connecticut in 8 locations, but they need their supervisors trained because we made them experts in this field or in this area of probation. It was hard for them to carry the torch when their probation supervisor did the same understanding of engagement in this area or roles. Some role in this statewide level, but people still reported directly to local supervisors, and it's imperative that all of the agency were on board, understand the goal as you move ahead, and implement new steps to probation. And I think with that, I am going to hand it over to Maureen to talk about, to Tom Hogan to talk about Connecticut or Community Partners in Actions.
Thank you, Brian. So what I'd like to talk about is a little bit what the services are that my agency provides. And as mentioned in the introduction, I previously worked as a probation officer, so I had the opportunity to use some of the contracted services that were available in Connecticut from a slightly different perspective. But now I'm seeing that from the inside. So Community Partners in Action runs a number of centers. We call them alternatives in the community. And around the country, those centers may otherwise be described as day incarceration centers. There's a number of different names. These programs were begun in Connecticut in the early 90s. And the primary focus at that time was to divert people from prison. So there was an emphasis on trying to manage the growing inmate population. So programs such as the ones that I work for were started at that point. However, in 2007, SSD revised the model of the program. So this was a really significant undertaking because it required decision-making on the part of the state of Connecticut through CSSD to make decisions about which types of services were going to be given priority. And this reflected a shift in emphasis from simply diverting people from prison towards trying to reduce the rate at which they were reoffending. So there were some assumptions that had previously been made, but over the years there has been more of a defined focus on trying to produce long-lasting behavior change rather than just on a short term trying to manage the inmate population. So the services that we currently provide include cognitive groups dealing with decision making and also with employment services. The client population that we serve includes some pretrial cases. So these are defendants who have been released on bond and they're required by a judge to report to our program while the case is pending. Also get direct referral cases from probation officers. So officers do assessments and they may make decisions about which programming clients may need based on the assessment results. In some cases, those are also be mandated as a condition of probation by the court. So we get active probation cases. Also a subset, Brian talked about the variety of caseloads in Connecticut. So many of the clients we get in our programs are probationers who had not been doing well on probation, were deemed to be in violation for some reason, and instead of seeking a violation, they're referred to our program to try to get them on track. Brian also mentioned the WOCM initiative, and just briefly to talk about that, we are not it was begun a pilot project under the direction of the National Institute of Corrections, and we have now expanded this statewide after that initial pilot. So a couple of things about that. First of all, the initial pilot was primarily a research project, and data was collected by the NIC contractor. But one of the reasons we were selected was also because we had already had a rich database that they could use to draw conclusions and to make decisions about the effectiveness of what we were doing. In addition, we had already had a lot of familiarity with the risk assessment process, and all of our staff had some significant training in motivational interviewing. So one of the decisions, even during the pilot, was that women that were assigned to the WOCM caseloads would also have contact with a treatment person whose role would be to, at the time called it a resource advocate, and that's somebody who would try to work on some maybe non-traditional needs that some of the clients might experience, such as employment, housing, child services, and whatnot. So a variety of issues that perhaps not all probation officers would have been familiar with. The programs that we provide include cognitive groups such as reasoning and rehabilitation. Again, this new program hadn't existed before 2007 in Connecticut. For when a similar group, moving on, is provided, so that also is dealing with some of the life issues that go beyond strictly substance abuse or mental health. Was started during the pilot, and it's now being provided statewide. Also provide education and coping skills training groups called Treating Alcohol Dependence, or TAD. This is not intensive treatment. Clients that need more involved substance abuse treatment are referred to other services, either that CSSD contracts with or that are otherwise available in the state of Connecticut. We've also recently begun an employment services group. So part of the emphasis is on preparing clients for a pro-life beyond immediate supervision. So employment has been given a focus, and the groups prepare not just skills and whatnot, but also the interpersonal skills that may help somebody to maintain a job for those that actually do obtain employment. And staff also provide case management, and when necessary, we can make referrals or let the provider source, whether it's the judge or the probation officer or the bail commissioner that deals with pretrial cases, if we feel someone needs more advanced services or something either instead of us or in addition to us, we can make arrangements for those treatment programs as well. Several years ago, the process was begun that our staff would use the same risk tools that probation officers use. So in Connecticut, the level of service inventory and the adult substance use survey revised are used for all probationers, but also used for all clients referred to the AICs. And one of the benefits of that is that we speak the same language. So in a sense, the process of creating data has also created a common language and a common focus. So it's created greater alignment with our sense of what it is we're trying to do with the clients that are referred to us. Pretrial cases, our staff do the assessments, and for cases that are sent to us from probation, those assessments are done by the probation officer, and we have various mechanisms for them to provide results. And because we use the same assessments, we can make complete sense of anything that's sent to us from probation, so we're on the same page with that. The collaboration includes data, but it also, we are working hand in hand with CSSD, and they are very helpful over the years in actually providing training. So not only are they giving some guidance as to what interventions they would like, but they training for our staff in some of the general principles of effective interventions. Here we call it the frameworks. Other places you'll see on the NIC website it's referred to the 8 principles of effective interventions. Our staff trained in motivational interviewing. They don't go to initial training. CSSD has contracted with quality assurance coaches who review tapes, who meet with our staff to give them feedback on the use of the skills. So one of the important things here is that it's not enough to just send somebody to training, but to reinforce and enhance the transfer of skill process is essential to get the kind of results we're looking for with our clients. Our staff are also trained in case management and client engagement skills, so when we complete these assessments, we need to transfer this from an abstract concept into something that the client himself or herself is equally focused on trying to change. And these groups that we provide, our staff need to know what the individual curriculum is, but they also need to know how to facilitate a group. So CSSD has been training our staff and preparing them so we can support their objectives of changing the long-term behavior of the criminal justice clients. As far as the data CSSD uses, some of it comes from us, and that's because we're using a system that CSSD created called the Contractor Data Collection System, or CDCS. And it's a secure web-based system, so when our staff enter information on the CDCS system, it's immediately being recorded in a CSSD database. So they have the ability to make decisions based on the information we're providing. This includes our risk assessment tools. So using the same risk assessment system that the probation staff use, this not only helps with scoring, but again, it records the data of what risk areas are showing up, what the risk levels are, and there's some other information that's fed to field staff to give them a sense as to what to prioritize. This also creates measures of performance, and these are things that are giving guidance for us to prioritize with our employees. So examples are the date of referral. So when is a client referred to our program? How long does it take for them to actually be seen for the first time. When you get the risk assessment completed, there's measurements for each of the individual services as to how many sessions the clients attend, but when the program started, when the group started, and when they finished. One of the steps in getting outcomes now is the idea of dosage. How much treatment is somebody getting? And previously, a lot of these records were either kept manually, they were difficult to retrieve, so and sometimes they were not kept well. So it might be very difficult to determine how many sessions somebody went to. So if decisions are going to be made as to the effectiveness of a program, it's important to have more specific information about what clients have actually done, not just the name of the group they were referred to, how many sessions did they attend, how long did it take for them to complete. Also, we record the reason that somebody's discharged from the program. There are a variety of options. It could include anything from a new arrest, incarceration, but it might be that they were referred to a higher level of care. It might be that they successfully finished the program. So each of these outcomes, we really have to drill down and figure out, for those that started, why did they not finish? It can provide a lot of information to guide our practice. So are there issues with clients not doing well? Or is it an issue perhaps that they needed a different treatment program from the beginning? There's a myriad of other decisions that can be made if that information is recorded. Provide employment groups, also important to know, did the person have a job when they walked in our door? So recording that status in the beginning is an important part of the decision-making process. We are also required to submit progress reports. So we're measured as to whether those are recorded on time. You can imagine with pretrial cases, if somebody's appearing in court and the judge is waiting for some information as to whether that defendant has been doing well or doing poorly, if we're not getting the information to the court, that delays the process, and that's something that we need to do in a timely and effective way. CSSD has, based on state law, has begun a process called results-based accountability. So the data measures are more than just kind of interesting, intriguing, or useful for general research. They are increasingly being used to establish benchmarks for our performance. So these benchmarks give us a sense as to what we're actually trying to accomplish, and to give you a sense as to how that changes our work. In the past, when the goal was simply to reduce jail overcrowding, a count of how many clients may have been in the program in any given day might have been deemed a success because it was felt that if they're in our program, they were not in prison. But increasingly, the goal is to change the behavior long-term of the client. So it's not enough that they walked in the door. Increasingly, we are being held accountable to achieve certain behavioral outcomes with those clients. The data entered is a source of how CSSD determines how effective we are. In addition, there are in-person audits that are done periodically, and this is not only us focused, but it helps CSSD to determine how well we're doing with what we said we would do when they awarded us a contract. In a sense, these may be a little small, but to give you some sense as to what's happened over the past several years, this is a snapshot of several of the groups. This is statewide data. It's not specific to the program I work for. There are a number of contracting agencies around Connecticut that run AICs. But on the top left, the snap that's labeled Reasoning and Rehabilitation, this gives a sense as to what the completion rate is for clients referred to all AICs in Connecticut over a period from 2007 to 2011. And you can see that the measurement showed a successful completion rate of about 65%. And over the past several years, that has improved considerably. and the successful completion rate is now close to 80%. Some of the treatment groups called TAD, treating alcohol and drug dependence, when first measured, successful completions were about 60%, and now they tend to be in the high to mid-70s. One significant measures, of course, is recidivism. And so one of the things we're getting very clear about is if we want to change recidivism rates, we need to have interim measures, because recidivism, especially for employees working with criminal justice clients, can be an abstract concept. So we need to have measures that show interim progress rather than just looking at recidivism. But when all is well, the objective is to have lesser rates of offending. So if you look at the 12-month rearrest rate for criminal justice clients referred to Connecticut AICs, for the past 5-6 years, the recidivism rate has dropped considerably. So the recidivism rate is now closer to, and my are failing me, so it's about 50%. Am I seeing that correctly?
I think so. It's hard to see.
Yeah. Okay. The significance of that is if that recidivism rate was not changing, or it was going up, we might conclude that what we were doing was not producing beneficial effects. CSSD completed an audit of each of our programs. We have 4 facilities in Connecticut that they audited, and we received a level 1 performance rating. And I can tell that was not something that came easily. It required tremendous effort on the part of all our staff and all of our management. But I'll also tell you it was a very beneficial process because it gave us in the process of trying to meet this standard, we discovered with much greater clarity what was really happening. So not only are we providing better data to CSSD, but this helps us to understand our day-to-day functioning much better. So it was as much a measurement as it was a learning process for us. Our goal as an agency is that we will certainly meet the benchmarks, but our goal is to exceed them. We want to get the best possible outcomes for both benefit of our clients as well as this Connecticut and our communities. One of the lessons learned is that the process of measurement doesn't just give you information, but in a sense it has also focused us all towards some standardized objectives. I began as a probation officer. I don't know that I even heard the word recidivism. It didn't have a lot of meaning for me. And again, the contracted programs were often focused on keeping clients busy. Increasingly, we are in alignment towards this greater goal of changing offending behavior over a longer period of time. So the measurement has changed our perception of our goal, and it gives us a greater sense of clarity. And data deficiencies we view as being unacceptable. So if we're giving bad information to our which in this case is CSSD, their decisions are going to be based on faulty information. So it's essential that we provide good information to them. And because outcomes matter, we are also, we've changed some of our strategies to get clients doing better much more quickly. And a very simple thing, one of our measurements was clients, how long it took for them to get into services. And we had some deficiencies in those areas. And even just over the past few months, we changed our practices. So as strange as it may sound, one of our practices in court was when a judge ordered somebody to go to the AIC, they were told to call the program. And you can imagine that when that they walked out of the courtroom, we didn't have much control as to whether they would call. Simply by being aware of this and setting it as a priority, changed some of our practices so that we either saw the person the same day or we gave them a specific appointment. And we've had 100%, close to 100% of each of those defendants has shown up since we've changed the process. So that's in some ways a simple change that we went through, but the fact that it was measured, it gave us a sense of clarity, and we were able to get a short-term change, which we expect will lead to longer-term change with these clients. So as the role of a provider, at this point, I'd like to turn things over to Maureen Delude, and Maureen's going to talk about the CSSD perspective.
Thanks. So you heard from both Tom and Brett how important the role of the service provider is in Connecticut. And what I'd like to share with you is a description of some meetings that we've implemented recently. What we do is we hold quarterly meetings, and we hold them locally. So in each region, with the service providers and all the stakeholders that are affected in that area, they do get together quarterly. And what they're doing is they're having meetings, and the goal is to improve service delivery. But the focus is on specific metrics. So rather than just getting together and having an open conversation, they are examining some performance measures or metrics and to see if they're achieving the goals in those specific areas. The conversation is guided by those metrics, and the group is looking for ways that they can improve the service delivery. And when they leave each meeting, they have assignments, and I'm going to do this, and you're going to do that. When we come back in 2 months, we're hoping to see that those numbers have gone up. Every quarter they get together and they continue to look at these metrics, they continue to have these discussions, and the goal is to continually improve. I'll talk a little bit about each step of that process. So you do need to pick what metrics you think are important, and you heard Tom talk a little bit about those performance measures. We start selecting those collaboratively, and I do think that's a really important piece of this. There's nothing nice about having a measure forced on you that you didn't have a say in. And so we get together with the providers, and collectively we talked about what are the central things that we think are going to affect outcomes for clients. And selected areas, we call them, our metrics are called risk reduction indicators, because these are the indicators that we believe are going to reduce the chance that a client is going to be rearrested. When we put the measures, then we had to select a goal. And part of the whole process was to look at where we had been. So we had historical data. We're very fortunate to have the contractor data collection system in Connecticut, so we did have data for their past performance. And we would take a look and say, okay, how did you do last year? And then let's say you were performing at maybe a 75% rate. Then you want to set a goal that's ambitious because you want to do just business as usual, but you have to make it realistic. If you have something where you're performing at 40%, you set a goal of 95%, it's just so discouraging and disheartening that there's no incentive almost to try because you're not going to reach it. So you want to find that balance between setting a goal that is ambitious, and you do want to push yourself to do better and find ways to improve services for clients, but you also want to make them so that it's reasonable to attain. Tom mentioned our metrics, but to give you an idea, I know sometimes people throw around these terms like metrics or indicators that we look at in Connecticut. We look at intake rates because we make a lot of referrals to programs, but we know what percentage of them actually make it through the door. If they don't get to the program, we can't help them. And so one of the things that we monitor at these quarterly meetings when everyone gets together is what percentage of clients that are being referred actually show up at the program. And if that's too low, then that's a concern, and we have a conversation about what can we do to improve the number of clients that actually make it to the program. We're worried about time frame. So we do look at not only do clients get into service, but how long does that take? Because we know that making sure that clients get into services early is an important aspect of delivering services. So we'll look at what's the length of time from the moment they're referred to the time that they're assessed. What's the length of time from the time that they're referred till they first get into services? And if they're taking too long, then we have conversations at these quarterly meetings to figure out what can we do to shave some time off of there so those clients are getting into the services that they need faster. Tom already mentioned service completion. We've carefully selected some curriculum and services that we believe are going to affect behavior, but they have to actually make it through the groups or make it through the services in order to have the achieved effects. So we do closely monitor the completion rate for each of those services. Our programs are focused on getting clients jobs, and so one of our metrics is looking at what number of clients got jobs in that particular quarter, and they're monitoring that very, very closely. Every quarter getting together and saying how many of our clients got jobs this particular time period. And Tom already mentioned we closely monitor the arrest rates because all of our collective effort is focused on the belief that if we deliver services and we deliver them well, we are going to affect the behavior of our clients, and we will see that recidivism rate go down. So that's an idea of some of the things that we're measuring. And when this group of people get together, they are talking specifically about those numbers, and those numbers are guiding the discussion. Now, getting stakeholders together. In Connecticut, the typical composition of one of these quarterly meetings, we have representatives from the contracted provider in that specific part of Connecticut. So these are happening all across Connecticut. They're regional, and so you get the local people talking about what affects them in their specific region, because you do see a lot of differences from different parts of the state, different client base, different courts. So talking about what specifically affects them. So you have representatives from the provider. We also have members of probation from that area, from the bail with pretrial services, from family services. And within CSSD, we have some staff members that are responsible for contract oversight, and they are represented also. So you get the nice mixture, and it's a good balance because you get the perspective from the court, you get the perspective from the provider, you get the perspective from the contract oversight, and they balance each other out in the discussion. So when they hold these meetings, they are specifically looking at the metrics, looking at how did they do this quarter, how does that compare to what they did last quarter, and conversation, in addition to celebrating where they've done really well, they identify the areas where maybe they want to make improvements. So if you're not meeting a goal, the conversation should be, okay, let's look at the clients that didn't make it this time. What can we do next time? What lessons can we learn from the clients that aren't maybe showing up for intakes or aren't completing services? Are there things that we can change in our system to improve that for next time? Important aspect of it is to assign responsibility. You want that meeting not just having had the discussion about, we want to improve in this particular metric, but want to say, I'm going to do this and you're going to do that. Next time we come back together, we'll see if that has actually impacted any of those numbers. There are a few examples. Sometimes, in these meetings, it's actually really small, simple things that you would say, like, really, you needed a meeting for that? But they do have big impact. One of the things I just sort of anecdotally heard people talking about, in some of the meetings, they just talked about having difficulty communicating with each other. Probation officers had a hard time getting a hold of service providers had a hard time getting a hold of probation officers. I said, well, maybe we shouldn't leave voicemails for each other. Maybe we should try emailing. And emailing actually worked much better than the phone tag that they'd been doing in the past. So sometimes these changes are really, really small and less tangible, but having that conversation, does lead to improvements in the way the system works. To give you a few examples of things that we observed, one of the things we talked before about was how, getting clients into the program. Historically, we either told the client, okay, we're going to make a referral, you call the program and make an appointment, or the program will contact you. So probation in some of the locations said, well, the client's sitting in front of me, I know I'm going to refer him to this program, I'm going to set up an appointment right then and there while the client's sitting in the seat. They know the date they're supposed to show up at the program knows when they expect that client, and the probation officer knows when that client's going. So all three parties are connected, knowing exactly what's going to happen. It shaves off the amount of time that it takes to get them in, and what you find is that if the client doesn't show, probation can support that, because immediately they know the client didn't show up, they know what the date that they were expected to appear. Other example is they were examining service completion and saying, some of the groups were just not getting the clients through the groups as often as we'd like to. So some of the locations they've been experimenting by holding groups at the probation office. Probation is a location that's familiar to clients. They already have to report there. And so they're holding groups, and what they've seen is they're seeing group attendance has increased in those areas when they hold the group in the probation office. The other aspect about that is you get immediate support from probation officers, because at the end of the class, if Johnny Smith didn't show up, the probation officer's in the building, he knows Johnny Smith didn't show up, and he get on the phone and try and get a client, get him re-engaged, and so you don't have that gap in service, and it really supports getting the client through the services that are necessary. And the third example, for our pretrial clients, we noticed that there were quite a few that would get partway through a group, then their case would be disposed just because of the timing of the court process. And so the idea someone came up with was, maybe the court, when they establish a court date, would set accordingly if they knew that the client just needed 2 more weeks to finish the group that they're participating in. And so we've redesigned the forms. They provide progress reports to the court and highlight, in order for this client to finish the services they're engaged in right now, this is their anticipated completion date. And our assumption is that the court is going to weigh that in the decision-making of what an appropriate court date is, and we're hoping that we will see more clients complete because the court dates will be set in accordance with the expectation of when the client will finish. So hopefully it gives you an idea of some of the types of outcomes that we've had from having these quarterly meetings. They've really been a great opportunity for everybody to just get together and make sure that their goals are aligned and that they can come up with good solutions. For a short time, we still have an awful lot to learn, but these are just a few things that I would suggest. Get bombarded with numbers. You want to limit the metrics. Just because you can measure it doesn't mean that you should look at every single number. So we look at about 5 to 6 metrics time, and you don't want to have 20 or 25 things you're trying to work on. You'll overwhelm yourself. Also, when you're in these meetings, you want to make sure everybody has an equal voice because everybody needs to feel that their comments or their suggestions are going to have just as much weight in the group as everyone else that's at the table. There's always potential when you're talking about not achieving a goal to turn it into a blaming game, and you want to work very hard to avoid that. Instead of saying, well, if you did this or if you did this better, we would be reaching our goal. You really want to focus on this is where we are, what solutions can we come up with to make it the next quarter. Another area is sometimes the conversation can really devolve into things that you don't have any control over. There's statutes, there's things in your court process, there's things that clients do that you're not going to control. And you can spend a little bit of time on that, but if that's all you focus on, you're not going to get the outcomes of these meetings that you're looking for. You want the things that you can control and make decisions about those. Another unfortunate aspect, once you start measuring things, people get really focused on numbers. And so if you're making a practice change, you just need to ask yourself, am I making it because it's best for what's best for the client and best for community safety, or am I just doing it because it's going to make that number better? There are times that you can do things, and I'm not saying you would manipulate numbers, but there just becomes this big focus on making those numbers look good. You always need to remind yourself the goal isn't to make your numbers look good, it's to have services that are well designed and that are right for the clients and that are right for your community. And hand in with that, you always want to remember that a number is just a number, and behind that there is a story for that client and that location. So when you see, if you have a goal of 80% and you're at 75, you're not supposed to want to stop at that 75. You want to say, well, what's that 25% that aren't achieving? Understand what their story is, and that will help guide you to making improvements. And then the final thing is, failure's going to happen. You're going to come up with ideas and they're not going to work. You all have to be okay with that. You have to stop being hard on yourself and hard on each other. It's better to have a goal and not reach it than to never set a goal. So just be prepared that there's going to be failures, and that's okay. And if something doesn't work, you know it doesn't work, and you can move on to your next idea. So hopefully that gives you some ideas if you'd like to implement something like that in your area. And I'm going to turn it back to Brian.
I want to quickly say if anybody has any questions to please submit them now on the right side of your panel via the Q&A feature.
Okay, I'm going to pick up a little bit on what Maureen was talking about. The reduction indicator reports are also something that the local probation offices have to look at to make sure that we're on the practices that we feel are most correlated to risk reduction, recidivism reduction. And use the data to come up again with a plan to address this. I'm just putting one of the multiple things that we look at in the New Haven office. That's the time to complete an assessment and to make a referral for a client. So once a case is disposed of in court, we have 25 business days to do our assessments, add the person to the evidence-based treatment, addresses the criminogenic need in the hopes, again, that we reduce their risk to recidivate. So we'll look at that on a monthly basis based on the number of new assessments that we get. Our goal statewide for any office is to be at 90%. So 9 out of 10 times we're completing that process, getting the person to the service they need in that door within 25 days. That's been a problem in some offices, including mine at times. And unfortunately, we took a business-as-usual approach. I meet with my supervisors and tell them that the number was unacceptable. We had to do something about it. And there were 2 issues with that. One, people, staff feel that they're feeding a computer and want to know why we have to do that. So it's important to be able to articulate the value in getting accomplished. So it's not just meeting a metric. It was the quicker we can get someone engaged in services, the more likely they are to stay in service and complete probation and reach that risk in their life as quickly as possible. And these people, want to do well on probation, and it's our obligation to get them there. So that again, through the agency, the hierarchy, we have to be able to articulate that. The piece is the business as usual. It can't happen that way. We have weekly meetings where I require officers to sit with their staff to go through metrics, to come up with a plan week to week so that there's a clarity of what we're trying to complete here. I'm trying to wrap this up and move it over to Tom now because they're running short. So I'm going to hand it over to Tom for the lessons learned.
So there's a lot of things we can take away from our experience, but first you have to define what you're trying to accomplish. So if your goal is to reduce recidivism, you need to be able to strategize backwards what are the steps and the things you need to do to get there. And the idea is if you do that, then ultimately the long-term goal will be achieved. When you can, start small. So if you can pilot something, you can work out the problems with smaller groups, you can learn what works, and that gives you an ability to be more effective when you go into a statewide or a larger implementation. You need to educate all levels of the agency. So people need to be consistent with what they're trying to accomplish. So probation officers, supervisors, but also treatment people at all levels need to understand that. And I would say if you have a receptionist or somebody who's the first person that your criminal justice clients come in contact with, they should have some awareness of what they do and how that affects the client's behavior. And so as we learned this from the WOCM project, we actually had volunteer officers, or we didn't just train everybody. So rather than trying to deal with resistance or people that didn't believe in it, we selected people that we thought were more likely to buy in. And when we were able to show some results, actually transform not just them, but other people in the agency began to see the value of it. It doesn't change what your staff do. So there needs to be a system of reinforcement to get your staff in alignment with some of these concepts. So results-based accountability certainly does that, but the period of meetings is also a system of reinforcement. Train staff in motivational interviewing, but they don't have a strong investment in changing outcomes. They may not have a strong need to actually even employ the MI skills. So our goal is not to do MI. Our goal is to get clients to change their behavior. And this way, the outcomes are in alignment with the training. I told training, that's you send somebody to training, they sign something that says I was there. Well, that's not going to get the results. If you don't actually transfer skill to staff, they're not going to be getting the kind of results that we're looking for. So the training has to be effective, and the ongoing support process of QA coaching is one way of improving skill, because very often people just leave a training only partially trained, and the learning process often begins after the training is ended. People have responsibility in order to achieve goals, and when you make those goals specific, people can actually get done. You can't implement an idea, you can't implement a notion, but if somebody is responsible for doing something, they're invested in actually getting there. So again, there needs to be a process of behavior reinforcement. If you're trying to change what your staff do, it's not enough just to say it. You need to follow up, and the process allows us to do exactly that. Keep in mind that sometimes if staff are not getting the results you're looking for, it doesn't necessarily mean they're resistant. Sometimes people have good cause to be hesitant. They have a lot of responsibility in working with an offender population. So hesitancy does not mean they're dismissing everything, and we sometimes can draw wrong conclusions from people's hesitation to get involved with new initiatives. The process of continuous growth is important, because staff, find if they actually find that they're being effective, they want to be able to learn more and to be more effective in the future. And as I mentioned, the process of measurement is not just numbers, but provides a focus. So we know what we are trying to work towards. So that's what we've covered. If there are questions, we would certainly be happy to answer any.
Great. Thank you, Chief Coco, Maureen, Tom, for your expertise and thoughts on the processes that you went through. I mean, these are incredible examples of how what I heard is that you first focused on looking at reducing jail and prison populations, and then it you really got this laser focus that it was bigger than that. That it was about long-term behavior changes. And I also heard you clearly state that you use data to help you define the problems and target those areas for change, and that they gave you baselines to measure your subsequent successes. And it's impressive work, and thank you for your contribution to the field at large. So this time we'd like to take some time to answer the questions from the audience. We've been collecting those questions along the way. So Pat, this question, I think I'm going to direct it to Chief Coco, and if there's another who would like to add on to it, please feel free. Often in systemic interventions, you must have stakeholder involvement for success. And this question is asking, how were your stakeholders informed and educated regarding the steps that were needed for implementation?
In pilots or programs that I was involved with, we ended up taking the lead a lot of times in probation. Myself and Tom, who spoke in with probation at the time, we had to take the lead. For some of these programs, we got in front of the LOB and our legislator and explained what we were trying to do. We met with, for me, the mental health provider in the state, reached out to other resources. So a lot of times, since we collect data well, we had a lot of the data, and it's important for us to reach out to other stakeholders. So we did a lot of that, initiating ourselves, putting things in writing, sharing the data, putting in graphs so that we could sit down with other people and explain where we were, what we found, and where we had to go, and then start to work together on how we were going to get there. So again, having the data and knowing what we wanted to improve. Again, as the example with clients leaving jail and not showing up probation, we had that data. And we had together with DOC, we had to get together with our contracted providers to ensure that services were available. So again, we carried the ball on a lot of that at the beginning and then made it more of a shared responsibility.
So as a follow-up to that, did you experience any unexpected resistance from the stakeholders as you targeted areas for change?
At least I did. Sometimes you come up with what you think are great plans, and people disagree, but it's important to remember that other people have other objectives, other goals, other interests that they have to protect or move forward. So even with the Department of Mental Health in Connecticut, they have a tough time working and sharing information with probation because we have the power to return someone to court. So I thought that would be more of a collaboration, it being kind of separate tracks in that part. So it surprised me because, again, we all had the objective to keep the person in the community, but the sharing of information on how someone's doing in treatment not readily available. So we had to work around that, understanding their perspective. So, yeah, frustrating at times and surprising, but it makes perfect sense when you understand where they're coming from.
Exactly.
This is Tom. I think even from a treatment perspective, I think there can sometimes be resistance or suspicion even of the model of treatment that we're providing. So anybody that works in this field has certain assumptions as to what they think offenders need or what they think will work or be beneficial. And what we're seeing is that effective interventions that change outcomes are not just helping, and they're not just silence and threats, but enough to be nice or to be helpful or to focus on what you think the person will be beneficial, but you need to focus on what assessments tell you are some of the issues. And historically, those can be abstract concepts, changing somebody's thinking or changing their attitude. So rather than just focusing on substance abuse, for example, we started using the CBT programs, but I think we're still implementing a change of thinking, even among treatment staff. This is what we should be providing. It's sometimes still a little bit mysterious. So in addition to the measurement, we also need to focus on the interpersonal aspects of helping people understand what this change process really is for criminal justice clients.
Right. Well, thank you. And unfortunately, we are running low on time to be able to ask more questions. But again, thank you, the panel, for your insight as to these issues. So I want to start to bring this to a close with some final thoughts as you all are moving forward with this very big task that's ahead of you. And I think even though what final thoughts I have is not on here, but I think it's important for you all to know is that there is a network of jurisdictions and professionals throughout the United States who have embarked on some many issues that you are in California, and I would say please reach out to people, continue to reach out to people, and use the resources that are available to you. I think that as we have heard today pretty clearly, that systemic interventions can safely reduce jail reliance and increase probation success. And as Connecticut said to us, that the probation success really is based on long-term defendant or offender behavior change. I think that it is also important for us to recognize that there are barriers around system collaboration around a common set of outcome and principles. And again, I think that our panel really was able to illustrate that they worked within their system, especially around a common set of outcomes and principles that kept them moving forward. And that there was a thorough planning process that helped to ensure that sound decisions continued to be made and that the outcomes are achieved. And it takes long-term commitment. I heard that also. I think that I hope that this information has been useful. I'd like to bring Gabriella back on, that she can really wrap us up and give us some final thoughts and where we go from here. Gabriella?
Thanks so much, Laurie, and thank you, Maureen, Tom, and Brian. This was all really, really useful, and Connecticut has been at the forefront of implementing evidence-based practices and interventions, and I think it's so helpful to hear about the struggles that you've had and also the successes that you've had. So thank you all so much for your participation today. And to the audience, we hope that this information was really helpful to you. On our website, we will have information regarding this webinar and past webinars, as well as upcoming webinars. In the week following this broadcast, we'll post the recording of this webinar and the panelist bios and other useful information. You should also be able to see a brief evaluation poll on the right of your screen. It'll only take about a minute for you to fill it out, and we really encourage you to provide your thoughts or feedback so we can continue to use your feedback to provide some high-quality webinars to you in the future. So thank you, everyone. Again, thank you, Laurie, for moderating and providing the NIC perspective, and thank you, Chief Coco, Maureen, and Tom for presenting all the work that you've done in Connecticut. Thank you, everyone. Have a great weekend.